So with that, I'm going to actually pass it over to Ava. Ava is going to take over with the rest of our discussion questions on the pediatric care side of things. So Ava, take it away.
I have a first question for you, Dr. Reber. I was wondering, how has COVID-19 generally impacted infant and pediatric care post-delivery?
Well, unfortunately, we're concerned as pediatricians because it seems that our children, our babies and our infants and children aren't getting their pediatric care. And that's a real concern. You know, if our infants and babies aren't getting their immunizations, aren't getting their well checks, we know that puts them at very high risk for developing problems and certainly diseases that we know that immunizations can protect them from. So, you know, I have, you know, some of the immunizations that we give our babies, like pertussis, for example, protect them from, pertussis is a very serious illness for our babies. And I think many of us as pediatricians have watched babies die from pertussis. And so we absolutely have to get our children in and get their immunizations so that we can protect them. And that's the biggest concern. We're just not, the babies and the children aren't getting in for their normal health care. And, you know, I really appreciate what the pediatric offices are trying to do. I know certainly here at Nationwide Children's Hospital and a lot of the other pediatric practices are really working with parents to make sure that they're protecting their babies. And they've always done this, but they're being even more diligent. So if you bring your baby to your pediatric office, you can call from the parking lot and say, I'm here, let me know when you're ready for me. So you bypass the waiting area, you go straight back to the office. They're going to be wearing masks. They're going to take good care of making sure that they're protecting that mom and that baby. So that's the biggest concern, and we really need to get these kids back into their well-check visits.
Would anyone else like to add anything, especially about properly vaccinating children during this time?
Well, it seems like I would just echo what Chris said or Dr. Reber said, and that is that we've developed, pediatric practices and clinics have developed ways of making it safe for parents to take their babies in to see their pediatricians and get their vaccinations, get their well baby checks during this pandemic. And I think it's important to realize that it's a balance between avoiding COVID-19, but also making sure that the baby gets all the things that they need to have a healthy start in life. And I think that that's really important. I think breastfeeding is a good example of that. When COVID-19 first came out, there was a lot of talk about not having moms with babies, not having moms breastfeed. But as Chris has pointed out so nicely, over time we've realized that the breastfeeding is probably more important or so important that with all of the safe precautions for COVID-19, you can do it. And I think moms should be encouraged to do that. I think parents should be encouraged to bring their babies in to see their pediatricians safely and with the protocols that the pediatricians have put in place. But I think it's really, really important. And getting vaccinated at 2, 4, 6 months is going to be really, really important for a safe start for the baby's life. And obviously then getting all the other vaccinations, but those in particular are really important. And it is safe within the guidelines that pediatricians and hospitals have made to bring your baby in for those vaccinations, and it's really important to do that.
Ava, if I could, I would just add one other thought, you know, just speaking from personal experience. Today I went to the doctor just for my regular checkup, and it was my first time going to the doctor since COVID, and things are so different. I was even talking to the medical assistant about it, you know, waiting outside and having to, you know, call and have your mask and get your temperature taken, and even going in a certain way and out another way. And so as you think about some of the families that we serve through Celebrate One, you know, it can be a bit intimidating because you may not know exactly what to expect because things are changing so rapidly, and what you might have been used to, you know, 1, 2, 3 months ago is so different. And that's why I am so proud of the work that community health workers do, not just affiliated with Celebrate One, but across this community, to help serve as navigators and ambassadors for our moms, because I think a big part of the battle is just knowing what to expect when you're, you know, going to the doctor, whether it's for prenatal care or if it's for well baby checkups, just having someone that you can ask questions to and, you know, get good answers and get good information, so those visits don't become intimidating and then become something that you don't want to do, because we know that moms have to go to their prenatal visits. We know babies have to go to their well baby visits. And so to the extent that different programs in our community can help break down some of the unknown, I believe it makes it a more positive experience for mom and baby.
Yeah, you mentioned kind of, I feel like the main barrier for moms is that there is so much unknown about this virus. And I think one of those is actually, there were reports further in the beginning about multi-system inflammatory syndrome, and they were coming out of New York, and I haven't heard as much since then, but I was just curious if any of you have any thoughts on how big of a concern that should be for parents, if they should be thinking about that is that a real fear?
So there have been reports of children developing complications such as that, and they're very rare, thankfully. You know, we're very fortunate with this virus in that we think it has relatively little impact on children from well, we think that they can carry the virus, but we think they're less likely to get ill than older individuals or adults with other health issues. Certainly, there have been children that have gotten very sick. And I know every parent's terrified about any risk, so there is always a little risk, but fortunately, most of our children are doing very well if they do get infected with COVID-19.
You know, when the number of cases came out from New York, it was scary. And now I know they're saying that it's rare. Chris, have you, or Laith, have you seen any at Nationwide Children's?
No, I was just going to say that at Nationwide Children's to this point, we haven't had any cases of multi-system organ involvement with COVID-19.
Great. I wondered about that.
Mm-hmm.
So maybe it is rare. I don't know what happened. Maybe it was a small little mutation in that virus in New York that caused that, and that horrible post-inflammatory reaction.
Mm-hmm.
Yeah.
And I think it is scary when we look at COVID-19 because it is a very new disease. I mean, this really has only been in our country for a few months. And for us to really understand the impact of this disease, we have to look, I mean, we don't know what's happening. There may be many people infected that have no symptoms. We don't know. And until we really have time and have a better understanding of how many people really do get sick from COVID-19, or how many children do develop some of these complications that we think are rare, it's just going to take us time. And that's terrifying, and especially terrifying if you're on social media and you're looking at Twitter and trying to figure out what's happening. So I think the bottom line is that we have to try to avoid getting infected with COVID-19, and that's why all of the social distancing and wearing the masks and doing everything we can to protect ourselves and our neighbors and our loved ones. But you know, we really don't know the full impact of it yet. It's just too soon.
You know, I wanted just to pipe in and ask your opinion, because I read all the cases and first came out in China and in that first year of life, and they didn't test for RSV, and these babies were sick and they were on ventilators, and it was the same time we were having that very harsh RSV virus here, and they weren't tested in China for RSV, and so it seemed to me that it was more RSV than COVID, and I think I've caught some of that in some of the literature I've been reading, that they also thought. So I'm worried about this winter when RSV and COVID are around. What do you neonatologists say?
Get your flu vaccine for sure. I keep saying that. So we are worried about it. I mean, but we're always worried about the flu. I mean, we know that our babies and children can get very sick from RSV and other types of flu. So anything you can do to protect yourself, and the protections really are similar to what we do with COVID-19, and that's good hand hygiene, masking will help, and social distancing. I don't know, Leif, if you have other thoughts on that.
No, I agree with you. I think it's really important to be careful in flu season, and flu can be really bad. I think we're going to continue to do some of the things that we've done for COVID-19 just in the last few months in the future during our flu seasons, because we do have flu and RSV and other forms of viruses that run through our units. And so to try to decrease those, we're going to probably continue to do some of the things that we're doing now to protect against COVID-19, because those viruses can be so bad during flu season.
I think there's definitely a lot of fear of what the future holds for a lot of moms. John, do you have any suggestions on what are good resources or methods that parents or moms can use to manage stress during their, especially with postpartum mental health during this time?
Sure. You know, one of the best things that people can do is have that support network. You know, oftentimes we have our moms who feel somewhat isolated or may not have that support system. And so whether it's a community health worker, I know Moms2Be and the work that Dr. Gabby does is, this is very foundational to their work about just having that network, having that support system. We make sure that our connectors or community health workers are armed with information about mental health, and really having conversations with mom that mental health is just as important as physical health and shouldn't be seen as something, you know, that has a stigma surrounded with it. It's, you know, taking those moments for breathing and meditation and connecting to whatever your spiritual being might be, and just normalizing all of that. You know, when people think about the times that we're in right now, these are high stress, high anxiety times. And if you've got families who are normally in stressful situations because they're worrying about where their food is coming from, or if they've got rent to pay to make sure they have stable housing or transportation, it just compounds in times like these. And so making sure that there is the availability of and connection to mental health professionals is so important for everybody, not just moms who are expecting, but for everybody. And you know, if you think about the African American community in particular, there has been over the years a lot of stigma about going to see mental health professionals, and so trying to break down some of those barriers and some of those stigmas is work that we're very committed to.
Can I step in and echo what Dawn is saying? Because at Moms2Be, we have 9 Zoom sessions every week, and we enroll new pregnant moms. Anytime, I mean, we just got a mom who was just about to deliver. I think she's 37 weeks. But she's invited to come in and be a part of our support groups. And we now have a wonderful, got a grant to allow direct access for online virtual mental health social work support. So we've offering counseling, and I think there's less stigma when you're doing it online and like over a Zoom session like we're doing right now. So please encourage all the pregnant women to Google Moms2Be, come to Moms2Be, enroll if you're pregnant, and we follow you and give you support until your baby turns 1. So I wanted to get that pitch in for Moms2Be also.
And the other resource I'll offer, Ava, in addition to Moms2Be, is an organization called POEM. It's an acronym, and I'm not going to be able to tell you what it means at the moment. I'll Google it and let you know. But it is a resource specifically for pregnant and parenting moms and connecting them with mental health resources. So it's a great organization. I only learned about them recently. They presented at one of our meetings, and the services that they offer are tremendous and a great resource for moms that may need some additional mental health support.
Thank you.
It's a great, it's a great organization.
I just echo what Dawn and Pat said. I think everybody's feeling some anxiety during this time frame, and then you throw in other stressors like job loss or getting food on the table, and then on top of that, being pregnant. I think I would be very surprised if a pregnant woman right now would not feel a fair amount of anxiety. And so I just echo what they said, and just reach out and get the help that you need so that you can yourself stay healthy. That's what the best thing you can do for your baby ultimately.
I did just look it up. It stands for Perinatal Outreach and Encouragement for Moms. Perinatal Outreach and Encouragement for Moms, POEM, and it's a program of Mental Health America.
Dawn, do you want to say one of the stress reducers is the stroller walk that you're doing in Celebrate One? Because moms that get out and exercise and walk, that is so important, especially during pregnancy, to get at least 30 minutes. Now, I know it's hard in this heat, but what are these strollers? Walks?
Oh, thanks, Dr. Gabby, for that plug. We have been doing Stroller Socials. We did them in person last year, and now they're virtual. But we have each week, actually there's one this evening, every Wednesday at 6:30. We have one of our community health workers who is actually going on a walk in one of either his or her neighborhood or a park nearby, and we do it on Facebook Live now. And so we offer some kind of tips or other information that we think might be helpful for the moms that we serve, and invite people to go on Facebook Live and walk with us in whatever area they're in. And actually this evening we had one of our connectors who is Somali lead the walk, and so we offered our tips in English and Somali. And we've got another connector who's Spanish speaking, and so sometimes we offer the Stroller Social in Spanish. So if you go to our Celebrate One Facebook page, you can go back and see the walks and the tips that were offered. Mayor Ginther walked last week and offered some tips to families. So we have had to, like so many others, just think about new and different ways that we can offer our programming given this COVID environment that we find ourselves in. And hats off to the team at Celebrate One, who continues to find new and innovative ways to connect with our moms. So thank you for that, Dr. Gabby. The Stroller Socials are every Wednesday at 6:30 on Facebook Live.
On every Friday, we have, at Moms to Be, we have Zoom sessions for children. So at Moms to Be, all of your children are invited. And that, having children at home has creates a lot of stress, I know.
Yeah.
And so with this Zoom session, it's led by child development specialists with games and activities and movement. So that's another stress reducer that we can offer.
What age child is that for?
Any child, any age, because some of our moms have older children and some have, usually it's geared more for toddlers, but any age child.
Thank you. That's good to know.
To switch gears a little bit, John, I was hoping to ask you, you mentioned before how Celebrate One's goal is to cut the infant mortality rate in half and cut the racial disparity in half. And I was hoping you could talk about, from a community and public health perspective, why Black Americans are being disproportionately impacted by both COVID-19 and infant mortality.
Yeah, so, what I would say to that, and certainly welcome the perspectives of the medical professionals on the panel, is that we know that there are inequalities that have an impact on one's both physical and mental health. And so when you think about someone's health and the social determinants of health, it's not just what's going on with them physically or mentally, but their surroundings. And so if you are in a neighborhood where there are high rates of crime, where you might be concerned about violence outside your front door, or as I mentioned earlier, if you are worried about whether or not you're going to be able to pay your rent or your mortgage, particularly in this time where we know that a lot of people have lost their jobs, and where those resources are coming from is an unknown, or even your ability to meet some very basic needs. If you think about diapers and wipes and formula and all those things that babies need that are very expensive, all of that is a stressor, and it has an impact on people both physically and mentally. And we know, and it's become even more apparent with a lot of the unrest we're seeing across our city and across our nation, there is a lot of inequality based on the color of people's skin. And so what we strive to do at Celebrate One, as I talked about before and you just mentioned, is to reduce the racial disparity. And while we've seen the infant mortality rate go down, unfortunately, we have not been able to penetrate that racial disparity number. And we've still got work to do in trying to figure out what other interventions might we be able to employ so that we can really see the infant mortality rate among African American babies go down. And it still is puzzling to us, but each day we're working diligently to see what other things we might be able to do to meet that very aggressive goal that the mayor set 5 years ago.
And I'd like to jump in and add to that, in that we look at the life course model and look at an African American woman who starts life and her reproductive life with fewer protective factors. She may have been born preterm. She may have been born low birth weight. And that sets her up for more hypertension, more type 2 diabetes, more obesity. And those factors, unfortunately, and even the history of slavery and being the epigenetic forces being passed from generation to generation from that stress, that sets that African American woman up at a reproductive disadvantage. And this makes it both a medical issue and a social determinant issue. So she really has a double whammy going for her. One of the things that we do, I want to reinforce what Chris said. Our moms really do need to get in early for prenatal care, get that blood pressure, that blood sugar checked. The other thing we do is we have a Dads to Be program, because we know that that stress that the mom is under, if she doesn't have a positive relationship with the father of the baby, can also contributes to her distress. So all these multiple social determinants combined with the medical risks really require us to put a lot of effort into achieving equity. We need to change those neighborhoods. We need to make sure our dads have jobs and our moms have jobs that they like. And we need early child care. And we need transportation. So it's not a public health issue. I mean, it is, we call it that, but it's a business issue. It's a civic issue. It's a moral issue. And, Don and the mayor have the right approach. We got to get the business community putting money into turning this inequality around.
I echo what Pat and Dawn have said. We have a lot of work to do as a country and as a community, and if we're going to impact these inequities long term. I think as a pregnant woman, again, I get on my keep saying, go get your prenatal visits. I mean, if you're a pregnant woman right now, what can you do? I'd say get your prenatal care, make sure we're keeping you healthy, breastfeed, and keep your baby in a safe sleep environment. That's just scratching the surface of the inequities that we have in healthcare and the disparities we see with infant mortality. But those are the best impact you can have as a pregnant woman in that time frame, is to do all of those things to make sure you keep yourself healthy and your baby healthy.
I do appreciate you, Dr. Reber, mentioning safe sleep. That is one of the key components of the work of Celebrate One. If I think about how my mom and grandmother slept me, it's very different than what you're supposed to do now. And so we've been really working to emphasize the ABCs of safe sleep with our moms, and now taking that to the next level, not just knowing what they are alone on your back and in a crib, but practicing them. And so in terms of another resource, Celebrate One offers safe sleep ambassador trainings, and they are available for individuals and groups. And we've shifted now to doing those virtually. So any group that might be interested or individual that might be interested in learning more about safe sleep, it's about a 90-minute training. We are now offering it in both Somali and Spanish in addition to English, and invite those who might be interested in getting trained in being an ambassador for making sure that sleep-related deaths don't occur in our community anymore. We welcome their participation.
That's wonderful.
Thank you for adding that in. I think that was all the questions we have. Does anyone else have anything else they'd like to add?
Well, I would just like to thank Blake and Ava for the invitation, for the initiative, and for your leadership. Infant mortality is such a huge issue, but you don't always see it as something that college students are thinking about and showing leadership around. And so I just want to celebrate both of you for your commitment, and look forward to exploring how we might be able to work with you in other ways, and just really applaud the work that you all are doing through the organization. So thank you.
Yes, absolutely. Thank you both.
I mean, there's hope. You've got another generation. I mean, you're much younger than I was when I started getting involved in this, so you got a whole lifetime ahead. I'm very hopeful that you're so committed.
Absolutely.
Yeah.
Thank you to you guys as well. You all have been a fantastic panel, and I know you guys took time out of your evenings away from your families and stuff to do this. So a big thank you for all of us. I wanted to give a special shout out. She couldn't be here tonight, but Lauren Hoffman is our head of design. She designed all the great graphics that we were able to put up on social media for all of you, and thanks to her. With that being said, we'll record this video, and we'll make sure to send it out to all of you, so you can send it out through your various channels of influence. If you think there are people or moms, prospective moms, that they could benefit from this information, we certainly want to get that information in their hands. That's the whole point of why we exist, after all. So hopefully we can reach even more moms than we otherwise would have by recording it. So thank you, and we'll definitely look to keep you guys in the loop on what we're doing, keep in touch with you guys, so that hopefully we can all work together and really sort of build this community around this issue in Columbus even further. So thank you guys so much.
Thank you.
Thank you.
Thank you guys.
So much.
Thank you.
Nice meeting everybody. Take care.
You too.
Nice
Bye-bye.
to meet all of you.